Hey everyone, welcome back to imt.bme. Today we're delving into a topic that's not only important but could be a lifesaver: emergency care. We'll be discussing the difference between emergency and accident care, when you should go to which one, and much more. First things first, there's a distinction between emergency care and accident care. Emergency care, or sürgősségi betegellátás, SBO in Hungarian, is for sudden and life-threatening situations. On the other hand, accident care is more for injuries that aren't immediately life-threatening. In emergency situations, having a valid toy card or private insurance is not a must. You will be examined without valid health insurance. However, after receiving medical care, you may have to pay around 20 to 30,000 forints for the examination and treatment. If you're experiencing any of the following symptoms, you should head to the emergency room or call an ambulance. Difficulty breathing or chest pain. Profuse bleeding, sudden loss of movement or speech. Fainting, poisoning, severe allergic reactions. Coughing or vomiting blood, severe dehydration, prolonged vomiting or diarrhea. Drastic changes in mental state, confusion, unusual behavior or strong suicidal thoughts. Intense headaches or sudden vision problems. Serious wounds, burns, broken bones, sudden intense joint pain. Persistent dizziness or weakness. Prolonged, uncontrollable fever. Rapid or irregular heartbeat, pulse below 40 beats per minute with associated symptoms like weakness, dizziness, altered consciousness or fainting. It's important to note that emergency care can involve a considerable wait time since patients are prioritized based on the urgency of their situation, not on a first-come, first-served basis. So, if you're heading there with or without a mentor, be prepared. Bring water, maybe some snacks, and ensure your phone is charged because it might be a while. The waiting time at hospitals varies based on symptom severity and the number of people waiting. Less severe symptoms may have a wait time of 4 to 6 hours. We recommend checking out the emergency section of the IMT website. The link will be in the description, where you can find a list of hospitals with non-stop emergency rooms. At the bottom of the page, you'll find a link that guides you to the right hospital based on your situation, but any emergency room will provide care if you're in need. Now, what about injuries? If you find yourself in such a situation, look for the baleseti sign at traumatology emergencies. Having a valid toy card or private insurance is not a requirement for examination at traumatologies either, but in such cases you may have to pay for the care received afterward. Wondering what injuries warrant a visit to traumatology? Head there if you have experienced accidental injuries such as wounds, fractures, bruises on head, neck, shoulders, arms or wrists, chest bruises, rib fractures, sprains, fractures of the thighs, legs, ankles or feet. In case of any accidents, you should visit the hospital based on where the accident happened. Please note that not all hospitals have traumatology. On the IMT website, you can find an interactive map where you can click on the area where the injury happened, and it will guide you to the location of the traumatology you need to visit. If the situation is life-threatening and you or your peer cannot be safely transported to the hospital, dial 112 to ask for an ambulance. This is an international number that works in all European countries. Remember to only call in situations where time is of the essence or you cannot get to the hospital otherwise to avoid expensive fines. Remember that in serious and urgent situations, health should always be a top priority. If you're ever unsure whether to seek emergency care or not, it's better to be safe than sorry. We hope this video was helpful. You can find all the mentioned links in the description. Stay informed, stay safe, and until next time, take care of yourselves. Don't forget to like, subscribe, and get a toy card.